Welcome to Sterling Visionary Voices, the podcast dedicated to bringing you diverse, innovative leadership insights and actionable strategies for success. Join hosts Laura McNeil and Bob Madeiros as they explore the art and science of role model leadership through thought-provoking conversations with real professionals. Whether you're a seasoned leader or aspiring to excellence, Sterling Visionary Voices is your guide to navigating the complexities of your leadership journey.
Hello and welcome to Sterling Visionary Voices. I'm your host, Bob Madeiros, and today we have the pleasure of talking with Jon-Paul Croom. Jon-Paul serves as the president of Wellstar North-Fulton Hospital, a 218-bed facility located in Roswell, Georgia. Since joining Wellstar in April 2017, he has played a pivotal role in advancing healthcare services in the region. Under his leadership, Wellstar North-Fulton Hospital has become one of Georgia's few Level 2 trauma centers, providing critical care services. Now, North-Fulton is part of the largest healthcare system in Georgia, WellStar Health System, one that is recognized nationally for its innovative care models and emphasizing quality and accessibility. Now, this background makes Jon-Paul the perfect guest to talk about our subject today, high reliability organizations in healthcare. Jon-Paul, welcome. I'm so glad you could join me.
Thank you, Bob. It's great to be here. Thank you for inviting me to your podcast.
Excellent. So this topic sounds really interesting to me. Tell me more about HROs and where this whole concept came from.
Sure. Yeah. I mean, the interesting thing is HROs didn't start in healthcare. They started, I believe, maybe in the 1980s and 1990s. A group of scholars taking a look at organizations that operate in these environments that, potentially could have, catastrophic failures, but those failures rarely occur. And they wanted to know why and how those organizations operated differently than other organizations. So they looked at things like nuclear power plants, like air traffic control, aircraft carriers, the whole airplane industry itself. If you think about each of those industries, when an accident occurs, it is very catastrophic. I remember living in Germany during the 1980s when Chernobyl melted, and it was it still has an impact on me today, thinking about, how that affected people. And it's interesting going back and looking at things like that, about why did that fail. But what these guys were mainly looking at is like there are, thousands of nuclear power plants, and we focus on the ones that fail, and we learn from that. But the big question was why do all of these other ones do so well and not fail? So
there you go. Well, so how do you see that concept applying to healthcare organizations?
Yeah, so I've been in healthcare since sort of the late 90s, and I would say very shortly after I became part of healthcare, maybe late 90s, early 2000s, these HRO principles started showing up in healthcare, because I think we recognize that, within healthcare, especially hospitals and places that are doing procedures and delivering medicine and monitoring patients, we also are in situations where we can have, catastrophic failures as well. And this led to this whole concept of how do we integrate some of these HRO thoughts in these other industries into healthcare. And so, over the last 20 something years, it's just been a kind of a continuous process on trying to become better hospitals and healthcare organizations by putting some of these principles in place.
Listening to you talk about this, it really is intriguing to me because, I spent most of my career working in organizations that supplied NASA, and where, reliability was king. You could not fail.
Yeah.
And so I love how this concept's making that transition to healthcare.
Yeah.
How do you see other organizations And I guess maybe the first question is, how are you and your organization applying it? And how do you see other organizations trying to apply this model?
Yeah, so I think with healthcare, I've been with hospitals, the hospital part of healthcare, most of my career, and I've seen lots of you know great care delivered. I've also seen instances of where we've almost made a mistake, and I've seen instances of where we have made mistakes. One example I would give, and this is a previous hospital, probably about 15 years ago. We had a you know, we had a patient that was on telemetry, and so telemetry in the hospital, probably people are probably familiar with it. But if you're not, they will hook you up to wires, mostly on your chest, and they'll monitor your heart rate. And usually there is somebody you're in a telemetry unit, but there's usually somebody in a room or multiple people in a room that are watching your telemetry monitor. So this was many years ago at a smaller hospital I was at, and we had a monitor tech that actually had done this for years, many years. And when they would take a break, they would alert one of the nurses, and one of the nurses would sit down and watch the telemetry monitor. And then one day she took a break and told the nurse, and the communication didn't happen the way it normally did. The nurse got involved in something else. Nobody watched the monitor, probably for about 10, 15 minutes. And unfortunately, during that time, one of the patients she was watching had a cardiac event. And it did not turn out well for the patient, and certainly not for the family. And of course, I was very involved in that, not just in looking at why that went wrong, but also having those conversations with the family about why that happened. And I think about that all the time when we're delivering healthcare. And, when we went back and looked at that, there were multiple things that that we were not doing to be a high reliability organization. One is we didn't have proper handoff. Two is we, should have, two people at least in a room watching telemetry at all times. If somebody has to leave, or, sometimes, something could happen to the person watching the telemetry and you may not know. So a lot of things have changed in hospitals since then. And I'm sure many other hospitals have similar stories that they could tell. But that's just, I think, one example of how it can really affect healthcare as well. And while we're not, a plane full of 350 people, every single person is extremely important. And it's important for us to make sure that not only are we, watching vital signs, that we're reacting timely, that we're doing things they've been ordered by the physicians, that we're not operating on the wrong leg and things like that. And all these things I mentioned happen, and they probably happen every day in hospitals across the United States, across the world. And, it's important for us to recognize that and create systems, put systems in place that prevent those things from happening.
Wow. That's yeah, that that's a scary example. So uh, what makes up being a high reliability organization?
Yeah, there are a few there are a few things for me, and I think you can look at lots of different definitions of what high reliability is and what they are. For me, I think the first one is situational awareness. Um, we have to always be aware that mistakes are possible. That we can't wait until a mistake happens. If we have this saying here, which is not unique to us, but if you see something, say something. If we share that with all of our team members, as starting with orientation, and we train that and we talk about it, and it's we encourage people to raise their hand, even if it turns out that it's not a safety issue. If it looks like it might be, it might not even be in your area, But if it looks like something that's out of the ordinary, that's not safe, please, tell a leader. We also have a system called Safer where people can put things in anonymous. But most of the time, we celebrate those individuals that raise their hand and find something that be like, wow, that's something that we were doing that we really should have a systematic way to keep that patient safer. And we, adjust and make changes and celebrate the employees that bring that forward. I think the second thing I would say is, we have to prioritize patient safety. It has to be the most important thing that we do. And we do lots of things at hospitals. Hospitals are just like any other business. We have to, do business. We have to, make a margin. We have to pay expenses. We have to, make sure people are having a good experience and that our team members are having a good experience. People are happy to work here. All those things are really important, but nothing is as important as keeping our patients and really our team members safe as well. And as I mentioned before, we talk about that all the time. I talk every week in orientation. I'm not the only one that speaks about patient safety, but that is the first thing. If we don't keep patients safe, what are we doing here? We have a daily huddle where we bring all the leaders of the hospital together. And by the time we have our daily huddle at 8:45 every morning, they've already had their own huddles with their departments. And what we're kind of looking for is any events that have happened or anything that doesn't seem safe, or if there's any transferability to another department. And we try to have that conversation in such a way that we can share any potential error that is arising, and we can jump on it quickly and try to address it before it ever reaches a patient. And so some huddles, we don't have any issues. Some we have small issues, some may be a big issue. And if it's big enough, or we think it could be transferable to another hospital, I'll have a separate call with my counterparts at the other hospitals within the system, and we'll talk about that. So, I think that communication, prioritizing patient safety has to be number one. And that kind of goes along too with, our culture of safety. It's a culture that it's not something you can just develop and sit back. It's constantly in development, because hospitals, like other businesses, we have lots of team members that come and we have lots that go. So there's always turnover and people going to work other places and new people coming here. So you have to constantly talk about it, because if you don't, every year you'll have a new team that doesn't know what you're talking about. And we do, as I mentioned earlier, we encourage everybody to report near misses, safety events. We try to set up a culture where there's not any fear of retribution, because we're humans and humans make mistakes. And we've gotten to the point where people report on themselves, which is great. And we take that and we learn from it, and we always ask, not what is the human error here, but how do we create something systematically so that this human cannot make the same error again? How do we catch it? I think one of the things with HROs that most people talk about is the whole Swiss cheese model, which I like, because I like to talk about things with pictures. Swiss cheese is like if you take a bunch of slices of Swiss cheese and you line them up, and if you have an error, that's moving along through space, it'll go through one hole in the Swiss cheese, and hopefully the next piece of cheese, if maybe it'll go through that hole, but maybe the third piece of cheese, it'll hit the actual cheese itself instead of the hole. And that's what we're constantly trying to do, is just move these pieces of cheese around so that we don't have these holes where errors slide through. And that is a constant improvement. And you'll never get to a point of perfection, because we always have new procedures. We always have new types of healthcare that are coming along. We have new patients that present in different ways. We have new people showing up. But we can continuously monitor our systems and make sure those things get better.
Very good. Well, this podcast is for leaders, by leaders. Do you have any suggestions for any leaders out there that may be considering following this model in their particular healthcare organization? Things to do and kind of things to avoid.
Sure. I think my my suggestion is kind of like with all things, you don't have to start from scratch. There are a lot of models out there already, and there are a lot of experts, people that do this extremely well, not just in healthcare but in other industries as well. In healthcare, I think one of the models we use is the Mayo Clinic.
Hmm.
They are known for a lot of intensive research around being a high reliability organization. And as experts in the field, people like Mayo and other places are places that you can definitely pull, systematic ways to prevent errors and apply them in your own organizations. And it just moves a lot. It moves a lot faster that way. I've always said I've never been the smartest person in the room, but I can find the smartest person and take their ideas and use it to make our systems better. And I think that's important for all of us, regardless of what industry you're in.
Well, very good. Any suggestion? Well, I guess anything that you would do differently if you got to start it all over again?
Yeah, wow. That's always a tough question because I think as your career goes on, you learn more. I know way more today than I did 20 years ago. I think if I was able to take some of my knowledge back then, it would be I wouldn't have made or been part of some of the same mistakes. And I think unfortunately mistakes are, fortunately and unfortunately, we make mistakes, and failure makes us better. It's never good when it happens. It certainly is horrible when it hurts somebody. We have to take all of those opportunities and learn from them. I think the worst thing, something worse than the error itself, is having an error and not learning from it and making a change to prevent it from harming somebody else. So I think it's a process. It's a process. I think I would tell my younger self it's not easy, but it's important, and it's something that we need to all work on to create high reliable organizations.
Oh, excellent. Well, Jon-Paul, I really appreciate what you've shared with us today. This has been really informative for me to see it applying in healthcare, and I'm sure it's important to our audience. So thank you very much. I appreciate you joining us.
Indeed. Well, Bob, it's been a pleasure. Thank you so much for inviting me.
Well, fantastic. To find other interviews, please go to sterlingvisionaryvoices.com. But until next time, this has been Bob Madeiros with Sterling Visionary Voices.
Thank you for listening to today's episode of Sterling Visionary Voices, Insights for Role Model Leadership from the Sterling Council. Discover more and connect with us at sterlingvisionaryvoices.com.